Hello, this is a presentation by Group 4 on Case Study 3, NIH Grant Proposal. Our topic is Parkinson's disease and traumatic brain injury, presented by Grace Shiba Anand, Natasha Ghosh, Kanika Mahajan, and Janhavi Raut. What is traumatic brain injury? TBI or head injury is a major public health problem, especially among male adolescents and young adults. The groups who are at great risk for TBIs are males, aged 15 to 24 years, and also risk elderly over 75 years. The health burden of TBI is immense. More than 5 million Americans alive today have a TBI, resulting in a permanent need for help in performing daily activities. Traumatic brain injury occurs when sudden head injury causes damage to the brain. Signs and symptoms: it can be mild, moderate, or severe. Mild head injury remains conscious or lose consciousness for a very short while moderate and severe head injury show these same symptoms but may also have headache that gets worse or doesn't go away. Repeated vomiting or nausea, convulsions or seizures, inability to wake up are among the other symptoms. Causes and risk factors of TBI: 50% caused by transportation accidents in individuals below the age of 25. In people 75 years and older, accidents are the major cause. 50% of TBI incidents involve alcohol use, and approximately 20% of head injuries are due to violence. These are the famous faces of Parkinson's. This is on the right is Muhammad Ali and left is Michael J. Fox. Complications of head injury. Complications are rare but increase with severity of trauma. They include seizures, infections, nerve injuries, and etc. Several disabilities can also arise because of head injury. One of the long-term disabilities that can arise is Parkinson's. It results from damage to a certain part of the brain called basal ganglia. Symptoms can show as early as 50 years in some cases. These are the symptoms of Parkinson's disease. Some commonly used herbicides are also known to be toxic to human beings and animals and has been linked to Parkinson's disease. It has been seen that people who drink well water have higher risk of developing Parkinson's disease. This is common especially in the rural areas. Some drugs also have been shown to cause Parkinson's-like side effects. Diagnosis and treatment. The main signs that a physician looks at is tremors at rest and involuntary rigidity when hands and legs are moved. Levodopa is the mainstay of Parkinson's disease. The life expectancy of an individual with Parkinson's disease is the same as a person without, as there are many medications available to treat Parkinson's disease. It's a slowly progressing disease, and in the later stages, individuals may no longer respond to medications, and complications such as choking, pneumonia, and falls may occur. So what are the preventions? At present, there are no proven therapies for prevention, neither is there a cure. Extensive research is being carried out in this field. Physicians suggest that consistent exercise for about 3 hours per week may reduce the progression of Parkinson's disease. And wearing a helmet is the single most effective way of reducing accident related to head injury. It decreases the risk and severity of injuries by about 72%. Results of many studies suggest that greater attention should be given to the long-term risk of Parkinson's disease after traumatic brain injury. Movement therapies like boxing, drumming have been shown to serve as remedies to Parkinson's even in patients in advanced forms of the disease. Existing research. Considering the seriousness of this problem, various research groups have tried to study the relationship between different forms of head injury and Parkinson's. The results from early studies have been mixed, both positive and negative have been found. Our study, in the view of this, our research group decided to study this relationship and come forward with a study plan. We propose that people who have history of head injury are at most risk for Parkinson's. 2 factors that we would investigate in this relationship are age, at which injury occurred, and how severe the injury was. Our study location. We proposed to conduct a study in neurological centers of 4 US states, located in Texas, California, New York, and Nebraska, owing to the fact that they have large neurological centers and Nebraska having the world's highest rate of Parkinson's. How will our study help? Our study results can help in coming up with new treatment plans and creating awareness among people who have head injuries in the past. Thank you.